of travelers that went to northern Italy. These are now 8 people that were in that group that all have tested positive. They all were together while they were in northern Italy, and over the last few days have tested, and all are positive. All of our LA County cases people who were traveling are all now tested, and they're all positive. They are all isolated. The second new case that we're announcing today is another screener at LAX. This is, again, a person who we believe is both linked to the first screener. They worked at that quarantine station at the same time. They are likely to have had the same exposure, but we have asked CDC to do the investigation. Obviously, that is under the federal jurisdiction at the quarantine station. That's Customs and Border Protection, and we will need them to complete that investigation. With these new cases, we still do not have any known public exposures, but we have identified a list of close contacts, families, friends, healthcare workers that are all being interviewed, and as appropriate, they too will be subject for quarantine from up to 14 days from their last exposure to a confirmed case. I want to remind us that in our 13 cases, 1 has been resolved. That was a traveler from Wuhan City who is fully recovered and no longer infectious. We have the 8 travelers. We have 2 family members who were infected. Their known exposure was another family member who doesn't live in LA County but was positive for COVID-19. And we have the 2 screeners at LAX. So those are our cases here. Again, we're not announcing any known community transmission because we have identified the potential sources of exposure for all 13 cases. Nonetheless, we know that as we see increased cases, there's greater concern in some of our communities about what this means in terms of steps people can take to protect themselves. So we're going to reiterate our main messages, which is for the general public, your risk still remains low, although this is the time to start making sure you're practicing what we call good public health hygiene. The primary message for everyone is to stay home when they're sick. The primary message for everyone, children and adults, is even with mild illness to please not circulate in the public, particularly don't go to schools and don't go into work. We've asked employers to make sure that they understand this directive and are in fact offering flexible, non-punitive policies that allow sick people to stay home. That means you're fever-free for at least 24 hours without using any fever-reducing medications. So for us, mild symptoms means you have a fever of over 100 and you have other either respiratory systems or stomach ailments, but that's a sign, if your fever is over 100, that is a sign for you to stay home. What you don't need to do if you have mild illness is you don't need to go in and see your doctor. You can call your doctor, particularly if you're a person with underlying health conditions or you're pregnant, but please don't just go in. This is the time for us to make sure that our medical professionals are able to treat those people with the most serious illnesses and not to have people with mild illness who actually don't need to see a clinician going to healthcare facilities to have their questions answered. Please use the telephone for that and allow your providers to make a decision about who needs to come in. And I want to flip then towards testing, because we know that one of the reasons why people may want to go in and see their provider is they want to get tested. So let me explain a little bit about testing, and bear with me because it might take a couple of minutes to get through this. I want to first clarify what a test kit is. So the test kit right now, when we talk about the test kit, is officially called the Centers for Disease Control and Prevention 2019 Novel Coronavirus Real-Time Reverse Transcriptase PCR Diagnostic Panel. That's a lot of words, but what it really is It's a kit that allows you to run probably about 800 tests. So it's not one kit per person, and it's not one kit per test. And one person may need to have multiple tests run from the kit.